Hey, I'm Dr. Jim Barnes. I'm a robotic bariatric surgeon out of the Highland Clinic. We're going to be talking about robotic surgery today, and we're going to take you on a little tour of the operating room and show you the robot that we use in all these operations now. So come on back here. And this right here is our Vinci Robot. When we talk about who's a candidate for weight loss surgery, obviously weight is a big part of that. And so we base that on their BMI. So if they have a BMI of 35 or greater, usually they're going to be a candidate for surgery. That translates roughly to about 90 pounds or more over their ideal body weight. So that's the first criteria. And then we also have to look at their other medical issues, make sure that we feel like they're a safe candidate for surgery, but the weight is the biggest indicator. We've been doing all these operations robotically for the last 4 or 5 years now, and that really offers some great advantages to patients. And so what we found with robotic surgery is that patients have less pain afterwards compared to the laparoscopic approach that we were doing before. Because they have less pain, we're getting people out of the hospital sooner. So now we do these big operations and people are going home the next day. It's just a one-night stay in the hospital. And then the recovery has gotten much faster as well. So typically most of my patients are going to go back to work in about a week and a half to 2 weeks after surgery. When we look at outcomes of these operations, and I'm always still kind of amazed at how these people do after surgery. So part of it is just looking at people's health. And we see people all the time that have diabetes, high blood pressure, sleep apnea, all these medical issues that get better so quickly after surgery. Most people get off of the majority of the medications they're taking. If they're using a CPAP machine for their CPAP, they get off of that. So people are dramatically healthier after bariatric surgery than they were before. Also because of that, they can just do more things. And that's just really cool to see people, just simple stuff. I can reach down and tie my shoes. I can cross my legs. I can get on an airplane and sit in a regular seat and not have to worry about that. And so, it's just the social aspects of it too that are a big part of this as well. With robotic surgery, there's a lot of technology. We do a lot of cases here, but we really still focus on the individual patient, and that's such a huge part of this. And so when patients come in and they come to one of our small group seminars, the first thing I do after that is meet with them individually, go through their medical history, do a physical exam, find out what their goals are, because not everybody has the same weight loss goal when they walk into this program. And so we tailor each person's operation to what their goals are, what they want to accomplish. And then it's a very direct one-on-one relationship that I have with each patient as they go through the process. I don't have anybody else in my office seeing patients. I see them all myself, all their post-op follow-ups. And so, and that's a big part of this, is the one-on-one individual doctor-patient relationship that I think really plays a big role in the success of the program for each person. We have found that robotic surgery is actually even safer than the laparoscopic surgery that we were doing. We've got an extremely low complication rate with this operations. It's not zero, because nobody's complication rate is zero, and there are some risks with surgery, and we go through those with each patient before the operation, so everybody has a good understanding of that. I always tell people these are the risks of surgery, which are very small, but you also have to look at the risk of not having surgery and the risk of morbid obesity, because I think for most people, those risks are going to be much greater than the risk of having an operation. There's a very steep learning curve to learning robotic surgery, and I started this probably about 5 years ago. And it took about a year to get where I was actually doing these operations on patients. And so we start with the training modules on the robot to just learn the basic techniques of how to work the robot. We go and observe surgeons that are doing robotic surgery. We go to training labs. I went to Atlanta and spent a few days down there training and learning more techniques. And then when we finally start doing these on patients here, there's a surgeon that comes in and proctors us for the first 2 or 3 days just to make sure that everything's going as it should. And then over the years, I do all these robotically now. For the last 4 years, I do all my surgery robotically, and I've actually started doing the proctoring myself now. So I will fly around the country when surgeons are starting out their new program and make sure that they're doing things the way they're supposed to be doing them. Bariatric surgery is a big part of my practice, but I do other general surgery as well, and we do all this robotically also. So I do a lot of gallbladder surgery, I do a lot of hernia surgery, I do anti-reflux surgery, I do diaphragmatic hernia repairs. So pretty much anything in the abdominal cavity that can be done, we can now do robotically, and I offer all those operations as well. I've been doing bariatric surgery for almost 30 years now, and I just really love it. To me, it combines the best parts of medicine. I love doing the actual surgery, the technical aspects of it. It's very challenging, it's very exciting. I love doing the operations. But the other big part of it is just the relationships you develop with the patients. You know, if you do general surgery, taking out a gallbladder, you know, you see a patient once, you do the surgery, you see him once after, and then you never see him again. But these patients, we follow lifelong. And so you get to develop these great patient-doctor relationships and see these people go through this transition as they lose their weight, get healthier. And I just love being a part of these success stories as they go through the process. Obesity is a big problem across the country, but it really, in Louisiana, is a major health issue. Louisiana always ranks in the top 5 in terms of most obese states. Even Shreveport specifically is in the top 5 in all the cities in the United States in terms of obesity per capita. And so it's a real problem here. And we offer a comprehensive program to treat morbid obesity, to get people healthier, more active, and back to enjoying their life again. I joined the Highland Clinic almost 9 years ago, and it's just been such a great change to my practice. I love being in a multi-specialty group like this. We have over 50 practitioners of different specialties all working together under one roof. I love that it's adjacent to the Christus Highland Hospital too, which really makes it nice if I need to pop over and make rounds or do surgery or whatever. It's just all right there. Working with the different doctors and practitioners here has also just been really great. There's a good camaraderie with this group. We have lunch together all the time. And it also makes it really nice when we're taking care of a complicated patient and we can get multiple doctors involved. We share the same computer system. It's easy to pick up the phone and call somebody if we need to discuss a patient and collaborate together, and that's just been really convenient as well. If you're interested in more information about weight loss treatment, whether it's surgery or medication, just give my office a call. That number is 798-4433, and we will be happy to help.